So a lot of these patients, when after they suffer an SCI or TBI injury, they become confined to a wheelchair. So now, if I'm correct or incorrect, please correct me. The goal is to get them walking again. There is a lot of different ways to address the situation of helping them walk again, and there's a lot of new research on getting their gait training back to what it was, or at least to a state where it could help them in their everyday life as their life has changed. What is the approach that you take to help a client get their gait training back or their
Um,
gait back? Excuse me.
yeah, the ability to walk, right, is what gait is. I do want to clarify though that the goal is to restore their independence. And what that means is, can I get myself out of bed, dressed, showered, to work and back, right? Like just things that we need to do on a day-to-day basis. They're called ADLs, activities of daily living. That really is the priority because that's what gives us humans, once again, going back to that why and reason for being and what gets us out of bed. It's our independence. No one really wants to rely on anyone else. So that is the overarching goal, no matter what. Now, if someone has the potential to recover walking function, then it is my duty to help optimize that and get them the best recovery that their body can get. In certain situations where I'm not expecting immediate walking return, and I know that they're only going to be with me in the hospital for maybe 3 weeks, 4 weeks, because of confines from insurance. Back in the days, people with spinal cord injuries and brain injuries, I'm talking 10, 15 years ago, were able to stay in the hospital for 7, 8 months, because it's a life-changing injury, right? Everything that you've known has just really, your life's turned upside down, and you have to relearn how to roll to your side in bed, right? Like simple things like that. So to kind of cover all that within 3 to 4 weeks compared to 6 to 7 months is, right, a lot less time. So how do we best use our time? Now, I'm going to try to bring it back in. So now let's say we went through our evaluation and we know like, hey, you have a yeah, you can make walking recovery, right? It's not one of those 2 to 3% chance type of situations. Um, then we're going to initiate that. And your question was, how do we go about initiating it?
Mm-hmm.
Correct.
Yeah.
So what the research shows us is that in order to make the most optimal gains and facilitate neuroplasticity, so the beautiful thing about the brain and the nervous system is that it is plastic, and if you use it, you improve it till the end of your life. Um, that comes down to thinking, memory, also moving and strength, right? So what we're doing is facilitating neuroplasticity. The way we do that is using different types of technology, maybe like the exoskeleton, which is a robotic walking device, or a zero G harness treadmill, which is essentially a harness over a treadmill that can offload some of the body weight off a patient. Um, because obviously, if they can't move their legs, we're going to need something to help this person stand up, right? Most adults are anywhere from 150 to 250 pounds. So, using technology to make sure that we're safe and that the patient is safe, right? Um, but aside from that, it's trying to take as many steps as we can per session and making sure that the patient's getting their heart rate up and working at an intense level. I'm not going to bore you with all the science there, but it's what is the safest way and most effective way to get this person up and starting to take steps. And at first, that might mean I'm moving your leg forward for you. And as your brain starts to make those connections, starts to rewire, so to speak, those highway lanes that I was talking about earlier, um, they start to move their own limbs. And now so once they're moving their own limbs, it's like, okay, let me put an ankle weight on there. Let me make this harder to continue improving. Would be, does that answer your question? I know that was a little all
Absolutely.
over the place.
Absolutely.
Yeah.